Hi, my name is Karen Loshbaugh with Art to Ride. We specialize in classical foundation training. And the reason for this is that if you do not get the horse engaging his back properly and carrying the rider properly, they will be damaged. It's very frightening to see the long-term damage that is happening to horses because of incorrect riding. It is not natural for a horse to carry a rider, so us as horse owners, trainers, riders, we need to learn how to engage the horse's back so he can more easily carry the rider and stay healthier. We're seeing too many issues of kissing spine, where they're broken in the neck, which we call the separation between the second and third vertebrae. We're seeing ligament damage, we're seeing muscle damage. The classical foundation training is that a horse should be healthier, move better, live longer, and be happier because we're involved in their life, not the opposite. We can't be destroying horses. We need to preserve them. And it's not that hard. It's available to anybody that wants to learn it and to try it and to apply it to their own horses. And I would like to introduce now Dr. Joanna Robson, who specializes in integrated medicine, because she will explain the biomechanics of the horse that will explain what incorrect riding can do to a horse.
Let's have a basic anatomy review first so that the viewers will have an understanding of the parts of the horse and how they need to come together to work as a whole.
The equine skeleton generally has 7 neck bones, 18 thoracics with 18 ribs, 6 lumbar vertebrae, 5 fused sacral bones, and 18 to 20 tailbones. The soft tissues, including the tendons, ligaments, and muscles, act on the skeleton and support the horse against gravity. Engagement requires these tissues to work in concert. The nuchal ligament stabilizes the head and neck, and elastic energy is stored in the neck muscles, ligaments, and fascia. The continuation of the nuchal ligament is the supraspinous ligament, connecting the tops of the dorsal spinous processes. The supraspinous ligament and other ligaments, as well as the muscles and tendons, anatomically influence the vertebral center of rotation. Protraction of the hind limbs, lumbosacral and sacroiliac joint health and mobility impact the hind end drive or impulsion. When activated in a strong core, complete the circle of engagement. This activation may best be seen in a hip tuck exercise. Equitopia went to UC Davis to further evaluate what happens to the spine when these core muscles are engaged.
So we know there's a lot of scientific research out there and you can frequently find conflicting studies, so we're going to make this really simple today. And if you could explain to us how we're going to conduct the experiment to show this process.
So we're hoping to prove this hypothesis that we all have, that by engaging the horse's core that we are in fact affecting the position of the vertebrae relative to one another, and specifically the dorsal spinous processes. And so what we're going to do on a horse that's standing still in a radiology room, which is obviously not the model that we see every day when a horse is ridden, but it's the best we can do, and it's a very controlled environment. The horse will be standing square, and we're going to take radiographs conducted in a lateral medial fashion of the back with a horse in a neutral head and neck position without any engagement of the core. And then we're going to repeat those same radiographs by encouraging the horse to engage its core by asking the horse to tilt its pelvis and lift its back. Ready? Oh man, good girl.
The study we have up here, the top row is the neutral position. You can see the spacing of the dorsal spinous processes. And on the lower row of images here, we have the images with the flexion of the back. And you can see pretty significant clear change in the spacing between the spinous processes, which is most pronounced in the mid-thoracic spine. This is really pretty cool.
Because the neutral position, we have 1.1 centimeter, and then in the flex position, we almost have 2 centimeters. So almost a double in the space. And if you look at this one here, it's completely closed, and then it opens up to 1.3 centimeters in the flexed position. So, I mean, that's significant. And what I find so interesting is that the most significant change that we're seeing in the separation of the dorsal spinous processes is right where the saddle would go. And so that's where the implications for riding are huge. And we've seen now with radiographic proof, this mechanism is very, very powerful, and that in fact the spaces between these bones in some instances will even double.
How does that pertain to riding? How, as we as riders or trainers, can activate the correct muscles in a horse? We all have to understand that the horse has no idea what we want to achieve. He reacts to nature. Nature tells him when something's unusual or if he feels pressure on his back. That in a horse's language is prey or it's uncomfortable. And what does a horse do? They hollow their back and lift their head. Usually the head comes up first and that drops the back. And that goes into, well, how do we counteract this? Because his reaction, which is a natural reaction, is not what we want. Remember, us riding them is not natural. So we have to retrain the horse to respond differently to the pressure of a rider on the back.
To develop a strong top line, the horse has got to be working correctly. So it's got to be pushing from behind, and its head and neck have got to be in either a neutral position, by which I mean that the head and neck are level with the wither, or the horse has got to be working a little deeper than that.
The minute the head comes up and the back hollows, the spine drops and the vertebrae get pushed together. And when that happens, the horse loses all flexibility from side to side. I have a lot of clients that are concerned with the flexibility of their horse. It's not in the neck, it's in the back. And you can't correct that by overbending the horse right or left. You need to get the horse to lift the back, separate the vertebrae in the spine, and then they'll have the suppleness to turn from side to side. Sometimes it's best to be able to experience it yourself. So I would suggest that you stand upright, bend over, and now hollow your back and lift your head. Many horses go around like this. Now you will feel it yourself what happens. Your back feels very tight. You don't feel like you can bend very well from side to side, and to take a big step is almost impossible. Now, the opposite, and this is what we're talking about, what we need to do with the horse, is to get the horse to lift and round its back like this, makes them very supple from side to side, and they can actually take very big steps underneath and get the hind legs underneath their body. So when you can get the horse, as we call it, go down and out, lower the pole and stretch it out, so the horse can stretch the muscles out, get the vertebrae separated, become very supple from side to side, and most importantly, start to be able to reach further and further underneath the body. Down the road, when we talk about collection, that will never happen unless the horse can start to reach under the body and start to take weight. You'll see horses in upper level that still are not reaching under their body. Their legs are either straight under the hip or actually left out behind. So the importance of teaching the horse to engage the back and round it up is, to me, one of the very root issues you need to deal with. It usually takes about 2 years. It doesn't really matter the age of the horse. A young horse, yes, of course, or an older horse that has never learned to engage his back. Keep the rhythm. There you go. Okay, now let's start it down. Let him go down. There. Good. Now start bringing him up now. Shorten your reins. Good job. What I mean by taking 2 years, it takes that long to confirm the back, meaning that the horse can keep the back up through most of your ride. So we really have to think about getting him to reach under deeper.
But we have to bear in mind that any position that the horse is in is going to provoke fatigue, so we can only maintain a position for a limited length of time.
It comes and goes as they develop strength, and pretty soon they're able to do it longer and longer and longer.
One of the concerns that might come up from people when we talk about a horse being down and out or stretched down is they might picture in their mind, say, an old style Western pleasure horse, or what unfortunately they term a peanut roller, where the nose might be very low to the ground and yet the horse is really short and really mincy in his steps. So how can we clarify for the viewer or someone trying to get educated the difference between a horse who's actually engaged in the core and correctly connected all the way through its top line, as opposed to a horse who might just be dropping its head and neck or just stretching down in the front but not actually connected through the hind end?
That's a very good question, because when people start to learn this philosophy and this systematic approach to gymnastically building up your horse, they're not always getting the horse connected over the top line. And throwing away the reins or just letting the horse plod along is not going to accomplish that. He's still not quite connected even though he's stretched. a horse is truly working over his back is actually, no matter how far the nose goes down, he's still on the bit, meaning that you've created this connection from the hind legs, pushing up through, over the back, way down into the pole, into the mouth, and back up into your hands. So you're creating this circle of energy, and a horse can go with the head down and still have a hollow back. It's very important while you're doing this is that once you get the horse to understand to soften his jaw and his pole to the bit, then when you give, he should keep searching for this contact. He should actually want it, because correct contact is wonderful for the horse because it gives him that security of knowing what you want. You can communicate with the horse very softly, very easily. True lightness is when the horse starts to engage so much over the back and start to actually bend the joints of the hind leg and start to take some weight. That way they can lighten the front end and become more maneuverable and lift and carry the rider. So it's very important though, before we get to this stage of the horse bending under, he first has to start reaching under the body. And the horse with a hollow back cannot reach far enough under the body, nor can they properly relax the jaw and the pole.
Horses can exhibit behavioral abnormalities such as becoming above the bit or behind the bit or having a very unsteady head carriage, either transiently as a result of an invasion because they're finding something difficult, or more commonly because there is an underlying musculoskeletal cause of pain, be it lameness or back pain. Any of those things can cause these resistances.
Now is a good time for us to touch on some of the damage that occurs from a veterinarian standpoint.
Absolutely.
When a horse is hollow in the back or dropped and saggy in the spine. Karen's already mentioned kissing spine, which is also known as overriding spinous processes. When these dorsal spinous processes of the vertebrae are not activated and open and lifted and everything hyperextends so the horse actually hollows or drops in its top line, those dorsal spinous processes are actually brought close together and in fact in some cases can actually rub on one another and create local irritation. And that irritation then results in inflammation, and long-term inflammation can actually cause Mother Nature to start to deposit new bone and try to fuse that area. If you look at the statistics, there's actually quite a few horses out there who probably have kissing spine, although a much lower percentage are actually presented for lameness. But some of the signs that you might see under saddle are bloating when saddled up, ears pinned back, uncomfortable when saddled, certainly tail swishing and ear pinning, and then even potentially bucking and rearing under saddle and refusing to go forward because of this pain and inflammation that has been created from this hollow or hyperextended position in the back. If it's not a traumatically created problem, then generally speaking it's a training related issue. And the other thing that you touched upon is this broken neck syndrome, or being bent over or broken in the neck. And it doesn't mean that the horse actually has a fracture in the neck.
Yes.
But it means that where this nuchal ligament attaches over the second cervical vertebrae there's a bit of a weakness between C2 and C3. And sometimes you'll actually see a physical bulge on the back of the horse's neck. And you were starting to discuss softness and connection, and how when the horse's hind end is out behind it, we would say out behind or trailing and unable to come beneath itself.
And the pelvis actually like flattens, doesn't it?
Flattens. Why does that happen? There's spinal nerves and reflex points along the lumbar spine and through these muscles in the top line and the middle gluteals and the longissimus as well. There's a fascial plane that connects up here, and fascia is like your thick white connective tissue. And if you press on these points, which you could do if you had a saddle that was too long, the panels extended too far in the horse's back, if the horse is just ridden incorrectly and ridden hollow so that there's a lot of tension in this area, those muscles in that fascial plane contract.
Yes.
And when they contract, it will actually pull your pelvis flat. You'll see the tail in tension, and the legs then are also put out behind the patient.
Because there's absolutely no way they can, with the pelvis tilted out,
get those hind legs underneath.
Yeah. Now, is this where you would start to see that L dip
Yeah.
between the sacrum?
So you're referring to a lumbosacral dip,
Yes.
an L dip. A true lumbosacral dip you'll actually see between L5 or L6 and S1, and a hunter's bump, depending on who you talk to, has a slightly different definition.
Hunter's bump is really a prominent tuber sacrale on one or both sides. This can be created by tearing of the sacroiliac ligaments, surrounding muscle atrophy, or thickening and inflammation.
That can also be caused by direct trauma. Say a horse is out in pasture and steps into a hole and tears those ligaments. But I do think it's really important that we talk about the stresses then that happen on the limbs
Yes.
when that horse is out behind and disconnected.
Because we're also seeing a lot of hock injections,
Hock injections,
and these
stifle
invasions.
injections, and
Yeah.
suspensory ligament issues in particular.
Yeah.
But not just in the back end, but in the front end.
Yes.
Because as the back end is not able to take weight or come beneath the patient, the horse may actually be loading improperly and incorrectly on the front end, and now all of a sudden you have a horse who's being taken out for a suspensory ligament injury or a flexor tendon injury as well.
Horses should be improved because we are in their lives. Many of these issues that Joanna is talking about are totally avoidable, but it just takes understanding how to engage the horse's back. Ride the horse with the back being your guide. That if the back is hollow, you should be doing nothing more than working on getting that back to raise. One of the things I want to point out is how important it is that we work with other professionals that see the horse's development in the same way. You can't have a trainer telling you one thing, the vet saying another, your farrier doing another thing. We all need to work together, and it's really important to find that circle of influence that works for you and your horse. The other important aspect is your saddle, your farrier, your body worker, and even the body worker for yourself, because you as a crooked rider will influence your horse also. And we also have professionals that will work with the rider's position. And when the horse engages properly and becomes connected, they feel totally different. This is a very brief synopsis of this training method, and it's not a new method. The classical masters years ago before us knew this, and we've lost that along the way, and our eyes are being trained to seeing horses inverted and disconnected, and it's slowly infiltrating what everybody's vision is of a correctly moving horse. So we need to counteract that and really point out the damages that we're doing to horses by this incorrect riding.
I think that both riders and trainers are lacking in ability to recognize lameness and to recognize behavioral signs that indicate an underlying pain-related problem. And that those people really need education to improve recognition of pain and behavioral changes relating to pain.
It's my philosophy as a veterinarian, as a rider and as a horse owner, to listen to the horse. I think we all have to be listening to the horse, and because they are trying to tell us things. We've learned that engaging the core is a critical part of mobilizing the back, and that it will prevent these spinous processes from grinding together.
See how relaxed that horse stays? I mean, to me, that's everything. And we owe that to him, right? By tucking right, I'm gonna cry. That is what it's all about.